So is there a question in the chat? And then it may help to review the 7 sectors. Janet, you want me to review the 7 sectors? I think I
Um,
reviewed some of them.
Hi, yeah, you touched on it a bit, but I just thought it might be helpful quickly just to remind everyone, don't panic. There's not only government jobs. I know you've made a post about it, but just a
Yes,
quick review
yes,
here.
yes, yes.
Other
Let's go.
sort of employment avenues, and then maybe a brief overview of like where their funding's typically from, maybe just
Calm
ground.
the nerves.
Yeah.
Yes, I like this. Let's calm the nerves a little bit and remind everyone. Yes. So, the way to think about it is there are 7 main sectors. The ones that usually are top of mind is government, nonprofits, and then you get into more of the universities and research. Then you get into philanthropy and NGOs. I'm thinking large NGOs, that global kind of space. Consulting groups. Those are private sector. There's so many. Guidehouse is an example. EY Consulting, AAC Disaster Consulting. There's just so many. Depends on the sector that you're interested in. And then there's these what is it called? Oh, healthcare hospital. Almost forgot healthcare hospital, but we did touch on that. And then the 7th is my favorite, is these membership-based associations that serve the workforce. And they tend to have titles like National Society, National Council, National Association. Sometimes they're regional, sometimes they're state specific. So like the California Primary Care Association, that's an example here in California. So it just depends on how you're finding them, but they're my favorite category because they are technically nonprofit, but they're not your traditional nonprofit that serves community. And so I put them in their own category because they serve the workforce. And they're just a little, I like them because they also pay well and they're mostly remote. If you want a remote job, you want to get paid 75,000 and over, even 100,000, these association-based groups really are cream of the crop for working from home, just doing your duty with a small and mighty team. So that's the seven overall categories. And in general, like, I think it just, all of them get funding from various streams. I think that's going back to my earlier point, these organizations, these companies do have multiple streams of income. You all are, some of you are thinking like, oh, they all get funded through federal government. No, there's a lot of private dollars that even, groups are pulling in, whether they're nonprofit, whether they're private consulting groups. Healthcare, I think, is going to keep public health afloat in a lot of ways. Right, Cynthia? I see you nodding. I think because from my direct experience coming just off of Kaiser, I helped a lot with their community health strategy for Southern California and partnerships and implementation of complex initiatives. And I love the work, but I just knowing that healthcare really is a for-profit organization that will always be in demand. And whether it's federal money or it's employer money that they get, or your money, like your private, from your own pocket. But, keep in mind that in America, yeah, our employers are the ones buying for our coverage. And so that model of just making sure our staff is covered, making sure everyone has their health. I think if you're looking for some sort of stable industry, healthcare could be that for you. Just in general, yeah. Jamila, I'm sorry, I'm at my daughter's. I'm reading your note. Hi, Zoila. Sorry, I'm at my daughter's gym class right now and it's loud in here. I'm happy to note that I received a job screen from the Tennessee Department of Health tomorrow. Congratulations. Are there any questions I should check with regarding the program funding or anything like that? It works with 10 care social determinants of health. So your question is, should I check with regarding the program funding? Excuse me. Jamila, are you asking for your interview? Are you asking that you're wary of the funding of your department because you're wary of if the job is going to be financially secure? Or are you asking
Correct.
because you want to raise? Oh, okay. Um, Again, I think this is an example if you're entering the state health department where your job might be covered by multiple streams of income. So if you want to raise it in a way that could, quote unquote, the question could kill two birds with one stone. In other words, how do I get more information on just their funding streams? Maybe that's the angle of your question. I don't think you should, if you want to raise it in a verbal way is what I'm saying. Like when you interview tomorrow, you can say, can you share more about your funding streams and how the department, what kind of agencies, federal or private, fund our initiatives here, or even tax dollars, right? We gave that example. So if you wanted just a general, like, can you give me a sense of the funding streams that support our work? Maybe they'll share a little bit of that. But then you could do your own background work, but sometimes these states don't really release this, when it comes to money, they're not always announcing how the money is, broken down. So you might just hit dead ends. So, and a lot of things are still kind of wait to see what happens. So they may not even be able to give you, the website is not going to share more. And even verbally, they may still also be just waiting to see if anything changes. So I would rather you use the opportunity to raise it as a conversation of, hey, I'm the ideal candidate. I'm ready to work with you. I would like to understand the partners, the funded partners, the funding partners, right? Who are the funding partners for the work? Does that help, Jamila?
Yes, thank you.
Yeah. Yeah, they're funding partners. And so maybe they'll give a little bit of a breakdown. Hope it goes well tomorrow. Is it your first interview?
No,
Is second with them?
this is the first one, but there was one previously, maybe a couple months ago.
Okay, great. Okay. All right. Well, sending you positive vibes. Study Total
Thank you.
Recall. Total
Yes,
Recall
we'll do.
will get it through. Yes. Keep us posted.
Okay.
Great. That's exciting. Yay. Interviews.